All right, let's talk about something you're going to use just as much as an IV line or a cardiac monitor, and that's conflict management. Seriously, if you're heading into the ER, getting a handle on this isn't just a nice-to-have skill, it's pretty much essential for your survival and, actually succeeding on the floor. So let's get into it.
Okay, so just imagine this for a second. You're in the middle of a chaotic shift. A family member starts yelling, their fear is just boiling over into anger. And then, in the very next room, you bring up a real concern about a patient, and the attending doctor just waves it away. Sound familiar? These moments are totally real, they are super stressful, and honestly, how you deal with them says a lot about how effective you are as a nurse. So the big question is, what's your next move?
First things first, we have to accept a basic truth about working in the ER. Conflict is a constant. It's just part of the scenery. It doesn't mean your unit is broken. It just means you're in a high-stakes place where a lot of passionate, stressed-out people are all trying to save lives at the same time.
So what are we really talking about when we say conflict? I mean, it's not just a simple disagreement, right? The textbook definition is that it's a process where one person, on purpose, tries to block another person from getting what they want. Like when a pharmacist is sticking to a protocol that's holding up a critical med you desperately need for your patient, that's not just a difference of opinion, that is a full-on clash of goals.
And this clash can happen on a few different levels. It can be personal, just between you and one other colleague, or it could be a group thing. Maybe the ER nursing team is always butting heads with the ICU team about patient handoffs. It can even be organizational, like when two different hospitals in the same city are basically competing with each other. The point is, it's everywhere.
So, if conflict is just a given, how do we even start to get a handle on it? Well, we start by understanding its anatomy, getting to the why of it all. If you know why a clash is happening in the first place, you're already halfway to figuring it out.
Yeah, this looks like a lot, and for good reason, because the real causes of conflict are super complicated and all tied together. Think of it like a bunch of gears all turning at the same time. Your goal might be patient comfort, but the surgeon's goal is to get them discharged ASAP. The cardiac team wants one thing, the ortho team wants something else, and then you throw in the rising expectations from everyone, plus the fact that the nurse's role is getting bigger and bigger. You can see how the whole system is just built for friction.
A full-blown conflict almost never just pops up out of nowhere. It's a process. It usually grows from a tiny little spark into a potential wildfire. If you can understand the stages, you can learn to spot it early and maybe put it out before it gets totally out of control.
It all starts with stage 1, the potential. Maybe the ER is just dangerously overcrowded and you're understaffed. The conditions are ripe. Then comes stage 2, cognition. That's when you actually feel it. A doctor talks down to you. You feel that flash of frustration. Stage 3 is behavior. You might snap back, or maybe they ignore your page, and action happens. And that leads to stage 4, the outcome, where patient care might get delayed and the trust on your team takes a serious hit.
And this is probably the most important thing to get from all of this. The outcome is not set in stone. It's a fork in the road. If you handle it well, that conflict can actually lead to better ideas or solve a problem that's been bugging everyone for ages. But if you handle it poorly, well, that's when you get people feeling defeated, mistrust, and staff just burning out. Which path you go down is all about how you act in those first few stages.
This brings us to a really important question about your own mindset. Is conflict just this bad thing we need to avoid at all costs? Or is it something else? How you see it completely changes how you end up managing it.
Okay, so there are basically 3 ways to look at this. The old school, traditional view is that all conflict is bad, period, a sign that something's gone wrong. Then you have the behavioral view, which is a bit more realistic. It says, hey, conflict is just a natural, unavoidable part of working with people. But this integrationist view, wow, this one is a real game changer. It basically argues that some level of conflict is absolutely necessary for a team to actually be good at its job. Think about it. A team that never disagrees just gets stale, right? They don't innovate. This view wants you to see conflict not as a problem, but as a chance for your unit to stay on its toes, to be self-critical, and to come up with new ideas.
Okay, so we've defined conflict, we've looked at what causes it, we've reframed how to think about it. Now for the really practical part, your toolkit. Let's break down the 5 main strategies you can actually use when you're in the middle of it. The first piece of the puzzle is something called assertiveness. It's pretty simple. It's just about how much you're trying to get what you want out of the situation. How focused are you on your own concerns?
And the other piece of the puzzle is cooperativeness. This is the flip side of the coin.
It's how much you're focused on helping the other person get what they want, satisfying their concerns. Every approach you take is going to be some mix of these two things.
And here they are, the 5 main tools in your kit. First up, you've got competition. That's when you're all about your own goals and not so much theirs. It's a classic win-lose power play. Then there's avoidance, which is the complete opposite. You're not assertive, not cooperative, you just check out. That's a lose-lose for sure. Accommodation is when you yield. You're not pushing for your own concerns, you're focused on theirs. That's a lose-win situation. Now, collaboration, this is kind of the gold standard we often aim for. You're assertive and cooperative, trying to find a true win-win where everybody walks away happy. And finally, there's good old compromise, smack dab in the middle, where everybody has to give something up. The key thing to remember is that there's no single best approach here. The right tool totally depends on what's happening.
So here's the bottom line. You don't have to just react on instinct. You don't have to fly off the handle or just shut down completely. By understanding this toolkit, you give yourself the power to take a breath, look at the situation, and consciously choose the approach that's going to work best for you, for your team, and most importantly, for your patient.
So as you get ready for that first day on the floor, or your next shift, just remember you have this toolkit. It is just as real and just as important as any piece of medical gear you'll ever pick up. The only question left is, when that moment of conflict happens, and believe me, it will, which tool are you going to reach for first?